York County Prison has the largest workforce of all county government departments. There are more than 500 employees who staff the prison 24/7, 365 days a year. As of today, the prison inmate population is around 1,300 people. Of that, 979 are county inmates and 327 are ICE detainees. By its very nature, there is a turnover of commitments and releases at our prison, more so than at state correctional facilities. This makes a fluid situation. When an inmate arrives at our facility, they come in right off the street with potentially an undiagnosed or untreated medical condition. And this is important to remember. As a follow-up to the recent media interest, we wanted to disclose our efforts taken at the prison to control this situation. The prison has conducted 1,463 COVID tests to date since April of this year. The prison conducts ongoing monitoring of employees and inmates. Within the prison, there are 3 units that have been established. COVID positive, where people are isolated. Potentially positive, where people are quarantined and tested weekly. And then we have the COVID negative unit. These have all been procedures and things that have been put in place to maintain safety of our employees and of our inmates at York County Prison. We started with our prison warden has spoken to Prime Care, who's our medical provider out there. And I would say a couple weeks ago, we started the process of starting to test inmates. Inmates coming in, transferring out, inmates that were there, anybody who had any symptoms. And obviously when you start testing, you have more positive cases. So in York County, the positive rate has gone up because of the number of people that have tested positive at our prison.
Of the inmates that have tested positive, what we can share with you is only 2 of them have been hospitalized. 1 has been released and is actually at home. The other is in the hospital recovering and doing well at this juncture. Other than that, there have been no hospitalizations of any inmates that have tested positive. So the status of those 20, the ones that are positive, as Commissioner Hoke had shared, there's a unit dedicated at the prison to house COVID positive patients. So they are there, they're in isolation, and we will follow the appropriate CDC guidelines prior to releasing them back into the general population.
In terms of the specifics of the structure and layout of the prison, I don't think we can speak to that. There's a standard approach anytime you have an outbreak in an institution where it's a residential institution. And this would happen in a nursing home, this would happen in a hospital. Same thing, you have a group of individuals who are living together. And what you do is you cohort them. And so you have individuals who, when you identify that are positive cases in a particular cohort, what you do is you do testing of that particular section of all individuals who are in the space where they were in close contact with that individual. And in a prison, it's a pretty broad number. And then what you do is you take that group and you say, here's the group that is positive. And they go into a cohort or a space that is would be an isolation. And Commissioner Hoke had it perfect. These are the groups that have tested positive and they're in that space. And that is where you watch them during the period of time where they're infectious and they don't have the ability to be in the general population. The second group is kind of like a yellow zone, if you want to think about it. Individuals who were exposed but have tested negative and have no symptoms. Those are ones that can over time develop symptoms, and that's a group you need to watch carefully and do repeated testing on to identify early cases so you can isolate them as quickly as possible if they do turn positive. And the last group is the group that's the general population that was not exposed. You want to prevent them from being exposed to either one of those first 2 groups. That's the process that's being done at the prison. Again, it's similar to nursing homes, and they're doing that in coordination with the state, using the same guidelines that we do in other spaces where there's outbreaks.
The individuals that are in the quarantine unit, we are testing them every week, and they will continue to be tested until the quarantine period has ended. I wanted to add a comment to what Commissioner Hoke and Dr. Howie said. We really are trying to be very transparent in disclosing this information. We have been in touch with the Pennsylvania Department of Health, with the corrections officer who's a liaison for correction facilities, and they are certainly supportive of the measures that we're putting in place.